Please go ahead, do the introduction.
Okay, good morning all. You're welcome to another edition of the YOF.
Yeah, I can hear you.
Pardon, can you hear me? Hello?
Yes, we can hear you. So please go ahead.
Okay. Good morning and welcome to another edition of the YOF Fortnight Academic Sessions. Today we are going to be discussing an important topic, which I think is apt both in terms of those people in Nigeria and those people that are thinking of Japan, even though we are not encouraging the Japan. The topic for discussion today is strategies for successfully preparing for and passing the local and
I can hear you.
board exams. Pardon?
Yeah, we can hear you.
It's all right. So today we have our distinguished elder in the field, in person of Dr. Anibe Ata, who is a fellow of the West African College of Surgeons and also fellow of the Royal College of Surgeons of the Edinburgh, and also fellow of the International College of Ophthalmology. So from the caps he's wearing, I'm sure you know there is no better person to actually deal with the topic than him. So I don't know, Mr. Chairman, can we start? So before he commences the talk, I will briefly introduce Dr. Atta. Dr. Atta graduated from the University of Calabar, and then afterwards he did his house job at the National Hospital in Abuja. Then he did his residency at University College Hospital, Ibadan. He worked as a consultant ophthalmologist at the Tulsi Charai Foundation Eye Hospital in Abuja. However, currently he's working as a special doctor in ophthalmology at the Medicine and Tunbridge Wells National Health Service Trust in the United Kingdom. Despite his busy schedules, he still finds time to play chess. So permit me to welcome Dr. Anibe Ata to give his talk. Thank you.
Hello?
Hello, yes.
Yeah, okay, sorry. Let me get my... Okay, is it in slideshow?
Yes, please, go ahead.
Yes, please, it is.
Okay, it's in slideshow. Okay. So, good morning. I want to thank the leadership of the Young Ophthalmologist Forum for this opportunity to speak on this topic, strategies for successfully preparing for and passing the local and foreign board exams. And thanks to the moderator, Dr. Miriam Idris, for the introduction. So my name is Anibe Ata, and we'll go straight into the topic. So I'd like to talk about this quote by this inventor, Alexander Graham Bell. He said, before anything else, preparation is the key to success. Just a minute. So now, of course, we can just abbreviate it and say that preparation is the key to success. And in anything we are doing, regarding the preparation for exams, relevant exams, whether local and international, preparation is the key to success. For the examination pathways, for the local exams, we have our local exams and then the foreign exams. And the local exams is suitable for practicing within the country. And then this West African sub-region, if you have the West African College of Surgeon certification, and then the foreign exams provides international recognition and opportunities. And I'll talk more about this as we go along. So for the local exams, we have the National Postgraduate and Medical College of Nigeria exams. And this includes the Part 1 exams, the Part 2 exams, and then the MD component. I remember the YOF has done a session on preparation for the MD component aspect of the National Postgraduate Medical College of Nigeria exams. So if you have the opportunity, you can avail yourself of that opportunity and get that degree, because it's equivalent to PhD. Then the West African College of Surgeon exams, there's the Part 1, the membership exams and the fellowship exams. Then for the foreign exams, we have the ICO exams, which includes the basic science and refraction, clinical ophthalmology, and then the advanced ICO exams, which gives you the acronym gives you the permission to use the post-nominal of Fellowship of International Council of Ophthalmology. Then there's a Fellowship of the Royal College of Surgeons of Glasgow Ophthalmology exams, which includes the Part 1, Part 2, and Part 3 component. And then the Fellowship of the Royal College of Surgeons Edinburgh exams, which includes the Part A, Part B, and Part C components. And then the Fellowship of the Royal College of Ophthalmology exams, which includes the Part 1 refraction certificate exams, then Part 2 written, and then Part 2 oral. Well, I wouldn't talk about USMLE or Australia, but the exams are slightly different. Yeah. So this is just what I just talked about. And for the Fellowship of Royal College of Surgeons Edinburgh exams, so I've started the Part A and Part B because over the years, so in my research, I've not seen this advertised on their website in the past and even in the present. But the Part C, it's if you've written the ICU exams, because there was a time the International Council of Ophthalmology had a partnership with the Royal College of Surgeons of Edinburgh. And so if you've passed the basic and clinical ophthalmology and then the advanced 180, then you have the opportunity to write the Part C of the Royal College of Surgeons Edinburgh exams, which is basically the oral. So the advanced 180 exam, it's more like the written component of the Part C, while you now have an opportunity to sit for the Viva or the orals or the OSCE. Then for the Royal College of Surgeons of Glasgow, there's currently a partnership between the International Council of Ophthalmology and the Royal College of Surgeons of Glasgow. At the moment, the partnership between the Royal College of Surgeons of Edinburgh and the International Council of Ophthalmology no longer exists. But for people who have written the exams in the past and have written the advanced 180, then they have the opportunity to sit for the clinicals or the Viva. And then for those who have not written the advanced 180, but they've written advanced 115, because I know one of my colleagues who had written the advanced 115. So he sat written components of the Royal College of Surgeons of Edinburgh exams, and then he had the opportunity to do the advanced one, to do the OSCE. Then for the Royal College of Surgeons of Ophthalmology, well, it's the same thing, but for this one, there's no partnership with the International Council of Ophthalmology. You need to write the exams directly. Now, the highlight of the meeting is the strategies to employ in passing these exams. So these exams, they have lots of similarities, and training at home, it gives you a good basis and opportunity to be able to ace these exams. Now, there's something that is common to all these exams, whether the local exam or the foreign exam, and that's the basic sciences, refraction, clinical ophthalmology, understanding of basic concepts in statistics, and then the guidelines that are relevant. So for the guide, so I'll just say something about the guidelines. So the guidelines basically, if has to do with the landmark studies, which provides the basis for evidence in clinical practice. So if you've read some of the research, some of the landmark trials that are being used, that forms the basis for treatments in glaucoma, treatments in retinal diseases, then yeah, you're good. However, certain things you may need to know concerning guidelines will be things like DVLA, which has to do with the licensing authority for driving, or things like Gillick competence. So for the basic sciences is relevant to our own exams locally, and it's also relevant for the exams written internationally. And so the basic sciences is what we write for our, so it's what we write before we start the residency. So the primary exams, basically, that's what we do. So these exams will still test all these things. So it's important that, you know, there's a depth of knowledge in the basic sciences. Then refraction, we do the clinical aspects of refraction, but the exams will test the theory of refraction. You don't, it's except the Royal College of Ophthalmology exams that will still test clinical aspect of refraction. The other exams at the moment, they test only the theoretical aspect of refraction. So, and this is in the form of MCQs. Then the clinical ophthalmology, this will involve having a good depth in understanding of clinical ophthalmology. And statistics, they don't go in depth, just basic concepts in statistics. So the question is, why these exams? Well, like the slide in my introduction, the why is, well, it's going to be a personal thing. I know that during the introduction, Dr. Miriam said we are not encouraging JAPA. But the point is, it's not all about leaving the country, because there's even reverse JAPA, so there's reverse JAPA, we can give back to the system. So there's brain drain and there's brain gain. So yeah, at the moment there may be brain drain, but there'll still be brain gain later in the future. or as the case may be. So why these exams? Why do we need to write these exams? Of course, the local exams shows that you have the relevant knowledge, and then you're qualified to practice as an ophthalmologist. Unfortunately, internationally, our local exams are not recognized. However, I'm glad to say that our training, well, from my experience so far, our training is robust. Our syllabus is robust. The rigors that we go through can actually make you competent to stand anywhere. However, since our local exams are not recognized internationally, so if you do these exams, then it gives you certain opportunities. So, like I said, it's not all about leaving the country. For some people, it gives them an edge when applying for fellowship opportunities. So if you have the ICU exams and you are applying for fellowship, so for the ICU fellowship, so the ICU fellowship gives grants and opportunities to travel to other countries to gain relevant experiences. And if you've passed the ICU exam, then in your application, it gives you an edge. And earlier, the ICU exams, there's also the International Ophthalmology Foundation exams now, which kind of, it's similar to the ICU exams. So they also have a fellowship, and passing the exams gives you an edge, okay? However, at the moment, there's no partnership between the Royal College of Surgeons and International Ophthalmology Foundation. But as far as I know, there is a partnership between the International Council of Ophthalmology and the Royal College of Surgeons of Glasgow. So it gives you an edge when applying for fellowship opportunities, because these fellowships, they are fully sponsored, and having having an ICU exam gives you an edge. Another thing, one may be in the country and you decide to set up either your private practice or even in wherever you are working. So if it's up to the individual, if you want to have an if you have one of these exams. So for some people, it can be like a marketing strategy or a business strategy. They display it in their office, and when they are seeing patients, hello, yeah. So it shows that. So for some people, when they are seeing certain patients and they see the display of an international qualification, well, is the way the world works. Some people think that, oh, having this, they'll kind of some patients will have more confidence in the doctor, but this is not solely the case. But you know how the world works, how people think. So, and of course, everybody does not need to write the exams. Again, why should one write this exam? Why do I need to spend money to write this exam? Well, I'll talk about something like I used to think that way when I started my residency. Of course, I wanted to write the exam, but I kept asking myself why. Anyway, as I talk more about the strategy, I'll share some highlights. So during so in talking about the strategies, I want to say something. One of my trainers, Professor Shai, said, he said, focus on being an excellent clinician, and it will aid you in acing your exams. So usually during my training as a resident, we don't have like exam break until maybe until a week to the exam. That's when you have an exam, you take time off to do your final preparation for the exams. So this was based on the philosophy that being an excellent clinician will aid you Well, and I agree. Well, I agree with that because you need to match the theory with expertise in clinical skills and examination. So what are the strategies? One, start early. You know, one is to start early in preparing for these exams. I don't know, it depends. I know that there are a lot of people in the audience, so it depends on the level you are in your experience. If you are starting early, if you're a first year resident, then of course, from day one of your residency, you start preparation for passing your exams locally and internationally if you want to. So if you don't want to, then that's also fine. So you start early, and this involves doing the relevant reading, participating in the rounds, doing presentations. In these days, I remember during training, Professor Lulaya would say that a record Kanski. He'll say, read Kanski cover to cover and record it. And some of us were thinking, how is this possible? But of course, it's something that is doable depending on your level of drive and what you want to, the sacrifice you want to uh, make to pass your exams. I remember one of my colleagues, he had an audio device that he will use to record during ward rounds, during clinical presentations, when consultants are teaching, and then he'll listen to it over and over. If you want to make memory aids, you can make memory aids, paste them by your bedside, paste them on your fridge, or paste them on your mirror. Those memory aids would help. So all this, it's to help in building the knowledge base. So like this ladder shows, the ladder goes up, and then you can climb these steps to the top and climb the steps back downward. So everything is linked. Okay, so starting early, knowledge base. So, and this will involve using the relevant textbooks to build a sound knowledge. So, I've said, from my own experience, I see the training in Nigeria. It's good, and it's not deficient. It's just that, unfortunately, nobody recognizes our own certificates outside. So building a knowledge base is very important. Then mastering the skills. So the clinical examination skills, one is to master it. The slit lamp examination, using the slit lamp microscopy with 90 diopter lens, 78 diopter lens, 66 diopter lens, the binocular indirect ophthalmoscopy examination, gonioscopy. It's not 1 week or 2 weeks to the exam that one should start practicing how to use binocular indirect ophthalmoscopy or using the gonio lens. For example, like gonioscopy, I first started learning gonioscopy by watching the videos. So if you go to gonioscopy.org, and then videos so these are videos made by Wallace Howard from the University of Iowa. So these videos help me to understand how to use gonioscopy. And I first did my first gonioscopy was still in my first year of residency, and I did it when I was outside on a posting in another facility. And then when I started doing the gonioscopy, I matched it with what I watched in the videos. I began to understand it. And then when I came back, and my teachers will ask me, they'll be doing gonioscopy and come and ask me, what can I see? And I'll be able to, and I'll get the, whether it's Schaeffer's grade 1, grade 2, or grade 3, or it's a closed angle, I'll be able to describe what I'm seeing. So things like gonioscopy is something that should be mastered.
Yep.
It's not something to be learned a week or 2 weeks to the exam. These things are relevant in our practice and understanding the basis of what we do, and in passing exams locally. Well, in the international exams, you don't do gonioscopy. Well, from my experience so far, you don't necessarily need to do gonioscopy, but having these skills gives you, helps you to understand and gives you confidence. So it's good to master things like binocular indirect ophthalmoscopy, because we know that it's also not all about exams. You are going to practice. And whether you are practicing in Nigeria or you are practicing outside the country, you must be confident in yourself, confident in what you are doing. And then I'll talk about networking. Networking, it's very important. In my first year of residency, I was still less than a year in residency when I attended the Ophthalmology Society conference in Jos. That was in 2015. And during the conference, I walked up to Dr. Oderinlo and I asked him, because I saw that in his, when his name was written, he had the fellowship of the Royal College of Surgeons of Edinburgh. So I asked him, how did he come about this qualification? And he told me that he wrote international exams and that I should I should write the exams, that ICU is providing these exams. So earlier when I was talking, I said, why these exams? So even after that interaction, I kept asking myself, why do I need to write this exam? I was thinking that these exams, they're expensive. But again, during my own time, the ICO subsidized these exams. You know, this is argument I'm having with myself. Again, I know that now the exams are even more expensive, but the decision is personal and it's up to an individual what to do. If we go backwards, our own teachers had certain things that we didn't enjoy. So even if the exams might be more expensive now, well, it's all about planning and it's all about the goals that one wants to achieve. However, my mindset changed about the why of writing the exams when when the International Council of Ophthalmology began partnerships with the Royal College of Surgeons of Edinburgh. So I saw it, I began to see the reason for the exams. I saw it that as an opportunity, that writing this exam will give me other opportunities that the local exams might not give me directly. And so going for the international, so my point here is that going for Ophthalmology Society of Nigeria conference helped me to network. That's one aspect. Another thing about networking, it's group discussion. So in my local exams and the international exams, I've networked with colleagues to build study groups. One of the things that worked for us, not just me, it's daily preparation. For example, when I was working as a consultant ophthalmologist in Tulsi Chanrai Foundation Eye Hospital, Abuja, I was quite busy. Okay, I had I'll go for example, in a week, 3 times a week, I have my theater sessions. So I go to theater, and from morning till afternoon, I'm in theater. Then I come back in the afternoon. I have my mandatory 1 hour break. Then I see patients in the clinic. And if there are lasers to do, I'll do lasers, YAG lasers, PRP, PI, depending. And then when I go home, I'll begin my discussion, like about 8 p.m., 9 p.m. I'll begin daily discussion with my colleagues. So we built this network. We were meeting online, and some of the people I was meeting with, some of them were in the country, Some of them were in the Middle East. Some of them were even in the UK. And we're meeting daily, preparing and doing discussion. So that's networking, the power of networking. If after work, if I go home and say, oh, I'm tired, I need to rest. If I was doing an individual preparation, maybe I wouldn't have been able to do anything. But having a group of people that I discussed with daily, so we're doing an hour daily, that made me to be accountable. They were like accountability partners. I have to be accountable. I have to be there in the meeting. I don't have to be the one that will be absent in the meeting. Doing these discussions daily, every day, we'll go through, and that brings me to the next point, past questions. We'll go through past questions, we'll go through textbooks, we'll read alongside, we'll look at the relevant past questions that are necessary. We'll look at the relevant textbooks that are necessary in revising for this exam. We're doing the daily discussion, daily revision, up to about a week to the exam. So for the Royal College of Surgeons of Edinburgh, this particular exam, it was a Viva exam, and we had 8 stations. Each station was 15 minutes. From my own experience, I would say I felt after the exam, I felt my local exam, I felt the West African College of Surgeons exam that I wrote was more rigorous. That was my own experience. I don't know about what others felt, but that was how I felt. I felt it wasn't as, I felt if you know the basics, you can pass. Each 15 minutes for 8 stations, and then there were clinical scenarios in each station. Though there were no live patients, but there were pictures of certain clinical scenarios, and then the examiners would quiz you, and then you discuss alongside. Well, it's an OSCE exam, so when you answer the questions, they'll ask leading questions that can guide you, and then you have to give the relevant answers, discuss the history, the relevant examination findings, relevant investigations, treatments, options, differentials. And during this process, during the process of discussion, if you could talk about the relevant evidence for what you're discussing. For example, if you're talking about, for example, one of the stations was about central retinal vein occlusion. And in talking about the management, I had to talk about the different guidelines, like mentioning the CIVOS study, mentioning the studies for use of anti-VEGF injections. Now, so understanding those clinical details helped. But again, like I said, power of networking with others, doing daily preparation meant that going into the exam, I was confident. My other colleagues that wrote the exams, they were also confident. And interestingly, for this exam, there were few of us, few Nigerians, but the few Nigerians that wrote, we all passed. And most of the other candidates were from Asia. Most of them were from Asia. Having a group and networking with others was a game changer. Then relevant resources. This includes the relevant books, like the most popular book, Kansky, that we use, the American Academy of Ophthalmology series, Oxford Handbook of Clinical Ophthalmology, then other materials like the Will's Eye Manual, and numerous other resources. There are numerous textbooks which are purely multiple choice questions that one can use for review. There are relevant websites that one can use for study. There's the cyber site, there's the University of Iowa library and curriculum that is helpful. All these steps would aid one to be confident. Confidence is very important. After working very hard, after working so hard, you must be confident in your ability to ace the exams locally and internationally. There is no need to fret. You know, one of my colleagues said, you are confident, but well, it's based on preparation. And even if you don't have the most information, you may not necessarily have the most information, but having prepared, the next thing is to be calm and confident. If you are calm, then you'll be able to discuss the relevant clinical situations in the different um, stations or in the different scenarios. For example, in the local exams, during the OSCE, you need to be calm to be able to do your examination and then record your findings. Like if you examine a patient and then in the next station, you need to record your findings. Being calm is very important. And again, I'll not fail to mention for local exams where we do refraction. As for refraction, refraction is a rate limiting step in the Part 1 exams or in the membership exams. So it's important to practice refraction. During residency, one of the things I did with my colleagues, and again, this all boils down to networking. I and my colleagues would go on Saturdays to the clinic and refract patients. We'll book patients and then refract them. There was no excuse that there's no time to refract. You have to find the time to do the refraction over and over and over and over. When you've done your refraction over and over, then you are confident on the day of exams. Confidence is key. If you're not confident, even if you have a lot of information, you may not be able to do your refraction very well. You'll miss simple things. Or if you're holding your refraction box, for example, and in moving to the next station, your refraction box falls, you know, that's like that's something that is like disaster. It's important to be confident. So when you're confident, you'll be calm and you'll be able to answer the relevant questions as needed. All this is key strategy in passing the exams locally and internationally. And like I said, these exams, they are written in different countries, not just in the United Kingdom. So like the Royal College of Surgeons of Edinburgh exams is written now. Initially, the one some of us wrote was in Edinburgh, but it's written in Cairo also. And then the Royal College of Ophthalmology Glasgow is written in Cairo, Amman, Jordan, India, Pakistan. Well, I see that these guys write these exams a lot. These guys from Asia. I guess one of these days, we too can bring these exams to Nigeria. We can write it in Nigeria. They can have a center in Nigeria. Well, it's something that can happen. And talking about the why of the exams, well, maybe in the future, the young ophthalmologists here can build a partnership and a network to have an examination center in Nigeria. So in conclusion, I'll say that thorough preparation so that we can have time for questions and to discuss questions. Thorough preparation using a group everyday approach was key in my own personal experience in passing the exams, both locally and internationally. I had a group of people that were preparing together and we're doing daily preparation. It didn't have to be so many hours. Initially, we started with an hour daily. Every day, 1 hour we meet. Every day, 1 hour we meet. And then during weekends, we could meet for longer. During residency, well, we met face to face or online, as the case may be, to prepare. If it's to prepare with either questions or to practice clinical skills. Group approach helped me a lot personally. I believe there are a lot of advantages in group approach in discussing with other people because people will bring various ideas, various points, various depths of understanding that could aid you in your own understanding and aid you in your own approach. So if someone says something, it could ring in your bell. It could ring a bell in your own mind when you're reading or when you are answering a question. In conclusion, so this is my picture when I was awarded the fellowship of the Royal College of Surgeons in Edinburgh. So I want to thank the Young Ophthalmologist Forum and everyone on the call. I hope I've been able to make some points, and I'm open to answer any questions that is asked or any clarifications that is necessary. Thank you very much.
Okay, thank you so much, Dr. Ata, for the beautiful presentation. For those that joined us late, Dr. Ata has taken his time to take us through the various types of exams that we could write, which include the local exams and the international exams. So he has explained that the local exams are essentially the fellowship exams we have for the two colleges. And then the international exams, prominently he mentioned we have the fellowship of the Royal College of Surgeons of Edinburgh, of Glasgow, and also the Royal College of Surgeons of Ophthalmology. And then there are other fellowships like the Fellow of the International Council of Ophthalmology and also Fellow of the International Ophthalmology Federation. If I say, I think IOFF, International Ophthalmology Fellowship Federation or Foundation. Sorry, I'm not sure now of the full meaning. So after that, he went on to now tell us the various strategies that you need to employ in trying to pass your exams. And essentially, he summarized it using a ladder, which starts basically with having you have to start early. Whatever you want to do, you have to start early. That is the preparation starts the day you start your residency program. So after starting, then you have to have a knowledge base, a wide knowledge base. So because all the exams have some basic components, which include the basic sciences, then the refraction, optics and refraction, the clinical ophthalmology, some statistics, and also things that have to do with the guidelines that guide practice in ophthalmology. So once you start early, you have to then widen your knowledge base by reading really in depth for your primaries. I will come in and give a short, initially when I wanted to do ophthalmology primaries. So that time there was this ferries. So that time we were told that if you cram ferries, you're going to pass the primaries. So that time I think I joined the discussion group about like 2 to 3 months before the primaries. So we read and crammed ferries. I went for the exams, I didn't pass. They said that it's not ferries of this particular year, it's another year's ferries that was used. So the second time we predicted some fairies, and they went again, and I failed. And I said, see, you have to stop deceiving yourself. You have to sit down and do the hard work. So that was when I had to go and get the AAO, the Basic Ophthalmology series and everything. I sat down, I read, I jotted. And I'm telling you, when I went, I passed both colleges at a go. So actually, there is no gambling. There is no shortcut. You just have to read and read and read. So after reading a lot of network, then your clinical skills, the skills are very important because it's not just for passing exams, but your clinical acumen in clinical diagnosis and management of patients, then a lot of networking, like we stand on the shoulders of our elders. So whenever you go to a group where you should try to attend ophthalmological conferences, initially during residency, you can attend the local conferences, but now we have this, the online conferences. So you don't even need to be physical. Even if you can't afford to travel, at least most of the conferences now have like the Zoom component whereby you can enter, you can join and gain a lot. Then the issue of daily preparation, use of past questions and relevant resources, having a discussion group that you always have something to achieve on a daily basis is very important. And finally, he concluded by saying that to cap it up, for you to ace the exam, you have to be confident. And you cannot be confident when you don't have a knowledge base. So the first thing is that you have to really prepare so that gives you the sort of confidence, and then you become to be able to discharge whatever knowledge you have in the background. So thank you so much, Dr. Ata, for that
Thank you.
presentation. So now the floor is open. We are going to go to the questions and answer session. I can see in the chat box.
I can see some in the chat box.
Okay.
Should I address some of the questions in the chat box?
Sorry, please, if you could just give me the edge as the moderator. I have also 2 questions for Dr. Ata. So now
Okay.
you said actually now the Royal College of Edinburgh, they don't advertise the part A and B on their website. And currently the linkage between ICO and FRCS Edinburgh doesn't exist anymore. So how does one go through the stages if you want to be a fellow of the Royal College of Edinburgh? And then secondly, I want you to expatiate more on the link between ICO and the fellow of the Royal College of Surgeons of Glasgow. Thank you.
Okay, so thank you very much. For the Royal College of Surgeons of Edinburgh, I've not seen the part A and part B on their website. Even when I was doing residency, I usually check, but I never saw. And even prior to this presentation again, I've checked again and I didn't see it. But on their website, I could see that there is an upcoming exam in Cairo for the part C, Viva or OSCE in Cairo coming up soon, later this year. So that's for that. And I think if one has the advanced 115, because when I wrote the advanced 180, then, so the advanced 180 was an opportunity to write. It takes care of the written component of the part C of the Royal College of Surgeons of Edinburgh. However, I know a colleague of mine who has the part one, the advanced 115, and he was able to write. He did a written component, but I didn't do a written component. He did a written component of the part C of the Royal College of Surgeons of Edinburgh. Then after the written component, he passed, and then he did the Viva. We were communicating during the process. I would say one thing is on the website, one can communicate the college. If you have the advanced 115, I guess you can send an email to the Royal College of Surgeons of Edinburgh. You can send an email if you have advanced 115 and ask how you could sit the written component and then the Viva. Okay. Then for the Royal College of Surgeons of Glasgow, currently from the after writing clinical ophthalmology for ICU. So there's a partnership, there's still an ongoing partnership. After the partnership between Edinburgh and ICU was cancelled, there's a partnership between Royal College of Surgeons of Glasgow and ICO. With this partnership, after writing and passing clinical ophthalmology, then one can sit the part 3 of Royal College of Surgeons of Glasgow. So what is needed is to pass the clinical ophthalmology. After passing clinical ophthalmology, then one can write the Royal College of Surgeons of Glasgow. And after passing, one will be awarded the certificate. Now, in addressing, like I'm seeing on the call that someone asked.
Sorry, please, the part 3, is it a clinical exam or a written exam?
No, it's clinical exam. It's not written. It's just a clinical exam. But for if one has, if anybody on the call still has an advanced 180, for example, advanced 180 takes care of written exams for Edinburgh. But if you have advanced 115, you still need to do written for Edinburgh before doing the clinical. But for Glasgow, the clinical ophthalmology component takes care of the written. So part 3 is now the clinical aspect. Okay, currently. Yeah, I hope that answers the question.
Yes.
Yeah, so let me add, so somebody said that, I think I'll take from this and then go back up since it's kind of linked. Someone said that, thank you, sir, for this information. Please, sir, how does one become GMC certified after having the FRCS? For GMC registration, you don't need, if you have FRCS Edinburgh, FRCS Glasgow, or FRC ophthalmology, then you can get GMC registration without writing PLAB. And if, for example, there are some ICU fellowships that are for the UK, if you are registered with GMC, then you could practice, or you could do clinical practice before you finish, let's say, an ICU fellowship and coming back home, rather than coming to do observership without any hands-on experience. Having a FRCS gives you can register directly with the GMC without writing PLAB 1 or PLAB 2. Can I continue with the other questions?
Yes, please. Yes, please.
So someone said, my question, people who already passed their part 2 in our local exams, is it too late to put in for part 1 of the FRC Opt? FRC Opt is it's a different exam. You have to sit all the components. FRC Opt is more expensive. So FRC Opt is different from FRCS Edinburgh or Glasgow. The thing with Glasgow and Glasgow at the moment is, with ICU, you could write it. But for part 1, yeah, it's not too late. Part 1 is an online exam. It's not too late for one to sit for it. The part 1 is basic science, and it's written online. You can write it from anywhere in the world. All you just need to do is you have to submit you have to show evidence that you're a doctor, or your primary medical qualification. You have to show evidence that you got it from an accredited institution. However, that's that for the part 1 FRC. But if you have, if anybody wants to write FRC Opt and you have, for example, GMC registration, then you don't need to provide. Anyway, maybe let me just address it. Yes, part 1, you can write it. Then my question is for people who already passed their part 2 in any other, is it okay? I've answered that. Has the MD program by the MPH, So the MD program, well, I didn't do the MD program, but one of my colleagues did it. Yeah, why I say it's, well, the MD program is equivalent to PhD, so it's only, it's, it will add to your, like it will boost your CV during interviews, and yeah, so it's still, it will be recognized if you have it, because it's part of your achievement. Yeah, so whether it's helpful out there, well, I don't have it like I said, but yes, if you have it, it will help you in your interviews, and it will show your level of experience. Um, is ICO exam still a pathway to FRCS? At the moment, no. Among the international exams, which one is easier pathway? Well, at the moment, I'll say that if you write ICO, then FRCS Glasgow at the moment. If you could do FRCS oft, part one, part two, and it's also a pathway, but it's more expensive. Yeah, so I like to know the requirements for practicing ophthalmology. So for practicing ophthalmology, have your GMC registration. If, well, even if some people are practicing ophthalmology and they went through the PLAB pathway, that as in they did PLAB 1 and PLAB 2. So even if you did PLAB 1 and PLAB 2, it's not going to stop you from practicing. But if you have relevant qualification at home, like you've done your training or you've done training in ophthalmology, it depends. You could get, even if you've not completed your training and you have PLAB 1 and PLAB 2, you can practice some level of ophthalmology. So yes. So the requirement is be an ophthalmologist or be in the ophthalmology program and show evidence. Then you'll be able to practice at whatever level you are coming in. You may, my colleague for Focus ICU Basic, you may network me in, good morning, you may network with me and my colleagues for Focus Discussions, ICU Basic Science and Refraction. Yeah, so anyone, yeah, so this is someone putting it on the call. If you're interested, you can form a group and then discuss. You can discuss network, and yeah, networking has helped me. I think networking is very good. Don't live in isolation. Be in network with other people. With Advanced 115, how do you navigate eventually? So yeah, like I said, Advanced 115, you could communicate the college, and you still need to do a written component of the FRCS Edinburgh, and then do the clinicals. Then you can get GMC. Well, MRC of this not existing anymore. What is existing is part one, refraction, part two written, and part two oral. An easier pathway for international exam. Well, you can do ICU Glasgow. You can do if you can do part one, part two, depending financially. Those ones are more capital intensive, but like you could do PLAB 1 or PLAB 2, still a pathway. Okay, email address, groups can be, well, I think if you want to contact me, you could, maybe it's for questions, fine. I don't know whether, well, yeah, fine, it's possible. Yeah, you can contact me. I could drop my mail for a contact. You may network with, okay. So now, one thing I want to find out, one thing I want to say is that looking at like this ladder I showed, what you do at home is very important. Currently, I'm working in a role, in an ophthalmology role, and learning, like at home, I did my first capsulorhexis as a resident. And then when I was working in Abuja, capsulorhexis was the standard. You have to do capsulorhexis for all your cases. And you need that for fecal emulsification. Currently, where I'm working, I have opportunity to do fecal emulsification. So doing capsulorhexis has helped me. Well, the fact that I've done capsulorhexis before, and then because it's a key step in learning fecal emulsification. So anything you are doing now, do your best, putting your best into it, because you'll need it. You'll still need the skills out there. And in my presentation earlier, I said it's not there's brain drain, there's brain gain. As we build our skills, we can also plan to give back to the country. We can also plan to help to improve the clinical environment at home. Well, some people have done that. So some people have done that. Some people are doing it, and we can still do it. Even if, like the founders of, earlier I talked about meeting Dr. Darren Lodri in OSN 2015 and discussing with him, and he telling me that, look, I wrote exams to be able to get this. He's in the country, and there are lots of people that have this international qualification, and they're practicing in the country, and they are doing a lot. Yes, so but many of them have experience, not just at home, they have international experience, and they are using the experience locally. So having an experience both at home and outside the country, it's part of, it broadens one's horizon, it broadens one's understanding, and we can use all these skills to help to build our own practice locally and help our own population. I think I've addressed all the questions.
Yes, Dr. Atta, I think the questions have been addressed. Then from my own side, I also want to just summarize also by saying that I think at the first onset, one should have a goal. At the moment you are starting ophthalmology, you should have a goal. What do you want to see yourself in the next 10, 15 years? Are you going through the international pathway, or you want to stay and be a local champion? So once you have that, then you have a plan, the step-by-step on how to get to your goal. If you want to go, you are planning to be international, it's better as you prepare for your local step-by-step exams, you should also do the international exams at the same time, because the preparation is essentially the same. Because I saw a question, after being a fellow of either WACS or NP, National Postgraduate College, then you want to start writing part A for the fellow of the College of Ophthalmology, it's just like going back now to start reading basic ophthalmology, refraction, whatever. So have your goal at the beginning, and then you should plan. Then you should also be prayerful, but however, you should also know that luck exists, but the luck should find you working. So please, hard work. There is no alternative to hard work. And another thing, I think during the residency program, there was one thing I made upon myself, that every clinic day, I try to learn at least one new thing that I know I have improved myself. Either is it a case I have seen that I will go back and read again, or is a clinical skill. But you can't learn clinical skill once you don't have the instruments. A way of helping yourself to learn the skills is by acquiring your own personal instruments at the beginning.
Very relevant.
That was what helped me to learn indirect ophthalmoscopy at a very early stage and gonioscopy at the early stage in my residency, because the lenses in the clinic are few, and the clinic is heavy. So if you don't have access to them, you'll be like, there's waste of time. But if you have your personal one by the side, you tend to practice and practice until you become perfect. So thank you. Now, I don't know, I will hand over the floor to the chairperson, YOF, Dr. Bature.
Thank you so much, Dr. Mariam, for anchoring the session so well. I can see Dr. Henrietta Moyi. Can you unmute? She's also in the UK. Do you have one or two things to say?
Okay, somebody asked for my email.
Okay. Yeah, you can drop it in the chat box. So, Moyi.
Hello, good morning.
Morning.
Good morning.
Okay, good to see everybody here. I think Dr. Ata has really summarized like everything, and like he said, it's knowing what you want in the first place, knowing what your goals are, and working hard for them. And I'd just like to say that I've known Ata for a very long time, like because we did residency together and we worked for a little while together in Tulsi as well. And all he said is actually true. You have to be confident, you have to believe in yourself, you have to put in the hard work. And once you've put in the hard work, like pray about it, like Dr. Miriam also said, if you have faith, and everything will kind of work out. Like you've already done the hard work, you've done the hard bits, and you've kind of followed the plan. Sometimes the plans work out as planned, sometimes they don't, and then you re-strategize and know what next to do. It's not easy, you don't have all the answers all the time, but you just have to follow through the plans that you have. And then the ones that when they don't work out, you kind of get a redirection and you just have to keep pushing forward. That's just it. So yes, work hard for it, be confident. And one thing I would like to stress, which has really helped, is the discussion Dr. Ata talked about. I don't know, during residency in UCH was really, really stressful. And there wasn't really any time for personal reading or study or anything. So we've always had a discussion group right from time. And that helped us. So when we're doing residency, we also did the ICU exams as well. So after work every day, we'd all wait behind and then we'll practice sometimes till 8 o'clock, till 9 o'clock, depending. And sometimes it's just 1 hour every day, but that really helped. And then subsequently, the residency exams as well, that's what we did. And I think to point out very strongly what he said about the experience that you're getting. So it's sometimes I know you're in a situation and you're feeling, oh, this situation doesn't pay you, but while you're there, you have to make everything count. So you make sure you're putting in your best there, make sure you're learning what you're supposed to learn there, because wherever else you go, if you don't have a very good background, both knowledge-wise, clinical-wise, you then find that you're lacking and then you'll be struggling to meet up. But if you already have those things, like you don't, when you leave, like if you have the opportunity, whatever you have, I know in all the centers, you probably don't have the full complement because you know how the country is of everything that you need to know. But then if you're in a place where you're learning something that you've not had the opportunity of learning elsewhere, then learn it while you can. If you have the opportunity of going to, for instance, a high volume center to go and learn something that you don't know, then utilize that opportunity because you don't know where you'll be next and when that skill will be called, when you need to put in that skill. For instance, he talked about going to Tulsi. And I also worked in Tulsi for a little while before I left. And I can say that that experience was like a game changer. So there were things I hadn't ever done in residency that I had the opportunity of doing it there. It was a lot of hard work. If you've ever worked in Tulsi, I don't know who has ever visited there, but it's a lot of hard work. But you have to look beyond that because it's hard work, but it's also you gaining a lot of experience, gaining a lot of skills as well. So I found out everything, both the experience during residency training, the stress of everything. There's no stress that will equal the stress I went through, for instance, residency training in Ibadan and then working in Tulsi. But after everything, so there's really no stress that you can't handle. You already have the knowledge, you already have the skills, or you built upon the skills that you've gained. Like Dr. Miriam said, learning one new thing every day in clinic. In the end, all those things, nobody's going to take them away from you. And when opportunities come, there are things that you can't start crash learning. It's just something that you built over time. So when you find yourself in a different environment, you're learning the way the system works, but you're not learning the basic skills that you ought to have learned before. So all those things then come into play. So I think that that's very important. Then in terms of the exams, the international exams, yes, you have to know the why of why you want to write them. It's not just because everyone is writing them, so bandwagon effect, you go and write them. You also have to do your research and know what pathway you feel is best for you. I think that if you're, just to say about the about getting, someone asked about getting GMC registered. There are different pathways and those laws keep changing. So whatever you're doing, I think you have to like think, okay, I want to do this. Then what's the timeline that you're looking at? And then you have to just follow it through because policies change all the time. Initially, the MRC Ed was a requirement for GMC registry, one of the requirements for GMC registration. And then having written the ICO exams up to the advanced level would give you the opportunity to get registered with GMC. But in 2020, I believe it was, I think it was March, early 2020, they scrapped that and they just took it off the list. And then everybody had been writing ICO up to that point, and then it seemed like there was no point anymore. And then they brought out the advanced 180, and most people were not interested in writing it. I would say I was one of those that was not interested in writing it because I was like, oh, we wasted all our money writing ICO. But I won't even say it was a waste of money because when writing ICO kept our knowledge to a certain level because you're learning things that ordinarily you wouldn't be reading for those things in the first place. So that also helps to build our knowledge. But then we also wanted to use it to get GMC registered just so you have more opportunities. But then they scrapped it and then a few other people went on to write Advanced 180. And I'll just say that all the people I know that wrote Advanced 180 were able to then write the FRC Ed exams when that became available. And all of them passed. They all did discussions together, just like Ata said, and all of them passed the exam and it wasn't really too stressful. So the thing is, the training that we've had back home is not useless in quote as some people might think.
It's not inferior.
It's not inferior. It's not inferior. But you just need to know what you need to have applied yourself while in training, even afterwards. So yes, you finish training, you feel you're deficient in so many places. We're not rocks. Move around. There are so many places you could gain experience, even in Nigeria. So many places. Like a point in case is Tulsi, like I said. And I think going to Tulsi was really a game changer for me because a lot of experience to gain. It wasn't easy, but it was really worth it in the end. So that's one thing to think about. Then I just want to stress it again because the aspect of reading for the exams and having a strong discussion network, it's very, very important. It can't be overstressed because the truth is you're tired after work, you're not motivated. But when you know that, oh, people are going to go online, they're going to ask you, why am I not there? And then you just join, it's just for 1 hour every day. It seems a little bit, but in the end, it all counts. And in the end, you keep moving forward. And then someone else says, why don't you do this one? I say, yeah, why not? And then you do it. And then you see that you just keep moving forward. So you have to like be sure of who you're keeping close as your network and be sure that you guys are all working towards your goal. Yes, okay, before I forget, I wanted to mention about the GMC, about the GMC registration. There are so many pathways apart from being careful to look at the to review the requirements often. I think there's something about some master's programs that are also clinical based. And afterwards, I think you have to get GMC registered through the master's program. So that's another pathway. There are so many. I think if you're really interested in that pathway,
I met one Nigerian that did that. So
you can go through the GMC pathway to see what those requirements are. And then there are so many other fellowships. I know there are so many people that have gone for fellowships outside that have found those things quite useful. So make use of the networks that you have. Ask questions. I don't think anybody will feel offended if you ask, oh, do you know about this pathway? What can I do to get this? There are so many fellowships, not just in the UK, even outside the UK. People have gone to Nepal, India, the US. Just gain the exposure. Like there's so much to learn out there. Life doesn't really end in. You need to know what's happening outside, so you can compete internationally. And then when you're coming back with a lot of experience, a lot of exposure, and I think it kind of changes your mindset. Even while you're here, somebody talked about attending conferences. That's very important. Attending conferences within Nigeria, outside Nigeria, there are so many things you can apply for. Join someone, join someone in research, apply for WOC, for instance. Apply for even AAO, you can get it. And once you started going for those things, it's like a band. So you've gotten one thing and then, when you apply for something else, you say, oh, and I also got this before, and then you're more likely to get it. And then it just keeps moving from there. There are so many opportunities, but you just need to ask the right questions. I need to also you might apply for, when you see people getting things, it's like, oh, this person is so lucky, they got this, but you don't know how many things they've applied for to get to that level. But if you don't apply at all, then how do you even start? That's the thing. So, yeah.
And
I think
those
I'll just stop here.
Thank you
conferences,
so much.
yeah,
Okay,
those
Dr. Ata.
conferences, they are relevant in your CV. Those conferences you're attending, OSN, international conferences, they are still important in your CV. So it's not a wasted effort. Yeah.
Yeah. All right. Thank you so much for the insight. Is there anyone here that has a pathway or that have been taking a pathway from another African country? I think you were mentioning Egypt, centers for exam from Egypt, maybe. What of the West African countries in Ghana? Are there centers that people can access?
No centers. I think in Africa at the moment it's Egypt is like the main exam center, and there are lots of, well, Egyptians write these exams so much, so I think they've built maybe a collaboration with the faculty, and then, yeah, they have. So there's no center in West Africa at the moment. Then, yeah.
All right, thank you so much. I think it has been an insightful session. Initially, I saw the hand of Khadija. Khadija, do you want to still say something before we close for the day? Oh, it was a mistake. Oh, she's not online anymore. All right, so thank you so much for coming
Tell
on
us
board.
about
But
Australia.
please check the chat box.
Okay.
Oh, okay.
The only thing I can say about
Australian part.
Australia is that if you, for example, if you have PLAB 1 and PLAB 2, and you've worked for like 6 months in the UK, then you can use the competent authority pathway to Australia. Or if after coming to the UK, you decide to do training, but that's, well, it's almost, if you are very, depending on the level, for anyone that's completed training in the UK, there's a certificate of completion of training. So with the certificate of completion of training, you could go to Australia, or competent authority pathway if you have PLAB 1 and PLAB 2. Okay, that's all I know about that. I don't, or if you write their primary exams, that's all I know about that, but I don't have further information. Thank you.
All right, that's fine. Okay, so we'll continue the discussion on the YF WhatsApp group, Dr. Moya and Dr.
Okay.
Ata
Thank you.
on the
Very
platform,
much.
so that all these pathways. So because people are asking about pathway through PhD, if you have something relevant to share, also the website where people can get further information, I think it will help.
Okay, no worries. Yeah, I could discuss in the YOF platform. Yeah.
All right. Thank you all for coming. Today has been a fruitful Saturday session. Yes, so we appreciate you so much, Dr. Ata, and our able moderator, Dr. Miriam. The RF exam is coming up this month. And I know the 2C Center, Abuja Center is at 2C Charai Foundation. People said all the slots have been taken. So many people are writing the RFF. People are not sharing information on the platform. Please kindly share information on the YF platform, people that are writing the exam, so that you can form a group, study together, and come out with flying colors. So all our people writing RF exam for the first time, we wish you the best of luck, and we hope to celebrate you more. Thank you all for coming.
Thank you, our able chair. Just before you log out, somebody is saying, how can he join the YOF platform? What's up?
Yeah, I will add him. You can contact any of the zonal coordinators or ESCO or anybody that belongs to the platform in your center to get access to the platform. But I know Dr. Abdullah Azere, I will add him immediately after the meeting.
It's all right. So, Dr. Ata, We wish you a fruitful and successful stay before we join you.
All right, thank you.
Thank you.
Bye. So our able chair, bye everyone.
Thank you.
Bye
Bye.
bye.